I've been told I am not a good candidate for hair transplant. If platelet-rich plasma treatment is not working, what are my options? I am 27 years old. I was told I am not a candidate for hair transplant. If the platelet-rich plasma treatment is not successful, what are my options? Hair transplant surgeon says if they make incisions, there is a risk of damaging the existing hair follicles. When will I be able to go for a hair transplant?
Thank you for your question. The age of 27, you've submitted a photo that shows a lot of thinning in the crown area, the top of the head, and that you have described in your question that you have seen a hair transplant surgeon who felt that you weren't a good candidate because of concerns regarding damaging existing follicles. Well, based on the photo that you submitted, certainly it is no question that you appear to have what is typically seen as male pattern hair loss. Now, male pattern hair loss is commonly a hereditary issue, and the choices that you have in addition to hair transplant also include medical therapy. Now, the medical therapy that is currently approved by the FDA in the United States includes two drugs. One is finasteride. Finasteride is a tablet that's taken daily, and it inhibits a particular enzyme called 5-alpha reductase, which prevents the conversion of testosterone to dihydrotestosterone. It's been well established that a certain subset of male pattern hair loss is associated with hair follicles that are sensitive to dihydrotestosterone. So when people take finasteride, they are diminishing the amount of dihydrotestosterone and reversing the thinning process. The other drug is Minoxidil. Minoxidil is over the counter under several different brand names. It's a topical. Minoxidil does not stop the progression of hair thinning, but appears to prolong the time that thinning hair stays on the scalp, making hair look thicker. At this time, there has been a lot of concern about the long-term sexual side effects of finasteride. So in our practice, we have a lot of patients who come to us for a treatment that we call hair regeneration, and I'll teach you a little bit about it. But the reason why a lot of younger males, 20s and 30s, are not even considering finasteride because of the concerns of the long-term sexual side effects. Paradoxically, we have many patients in their 40s and 50s and older who have been taking finasteride for years, since the late 90s, without any side effects. So this is just the way things are at this time. In our practice, we do a treatment called hair regeneration, and we've been in a leadership position, and I'll teach you a little bit about what the concepts are, and perhaps this might be useful to you. It is well understood that hair growth, it requires a lot of complex cells and signals. And I think in the basic science literature, it has been clear that there's so much that remains to be known. Many years ago, it was noticed that a material called extracellular matrix derived from pig bladder, when used to help heal a donor area for hair transplant, the thinning hairs near the donor area actually became thicker. Over the past couple of years, in our practice, what we have been developing is a method combined with a formulation for male and female pattern hair loss, as well as some unusual types of hair loss that make up a smaller percentage, such as alopecia areata, as well as lupus. What we do is an injection, and this injection appears, and it's a single injection so far. We have about 3 to 5 years of data supporting this. Where this injection appears to reverse the thinning process, It's a clinical observation that we're using a wound healing technology that is combined with platelet-rich plasma, which is derived from your own blood, and a single injection treatment has helped hundreds and hundreds of patients who have come to us from all over the world treat their thinning hair, and this applies both for men and women. So you can consider this type of option and learn a little bit more about it and find a provider that performs this procedure. And that is an option that I think would be probably indicated for you. And I'm basically speaking as if you had come to our practice. This is exactly how we offer treatment to our patients. We don't go straight to the injection. We educate our patients about the medical therapies, and then they make an informed decision on whether or not to do the injection. So in summary, you have medical therapy as an option that includes finasteride and minoxidil, and that you also have something to learn about that we call hair regeneration. That is a combination of platelet-rich plasma with extracellular matrix. So I wish you the best of luck. I hope that was helpful, and thank you for your question.